Okay, side effects. Now, side effect management. This is always important, in any kind of medication treatment. But this is really what's going to make it or break it in the long run with people with bipolar. Because the reason they stop taking the medicine, sometimes it's denial. I don't have bipolar, but usually it's because of the obnoxious side effects. So really keeping an eye on this. And I've heard patients say to me when I give these talks, I give them talks for lay audiences on bipolar patients or their families come up and they say, well, my psychiatrist says, I complain about, I put on 30 pounds and I'm sleepy all the time. My psychiatrist says, well, you just have to deal with it. Now, sometimes it turns out that may be the case if you've tried everything possible to address that. But my concern is that, this attitude of, well, you just have to deal with it is not appropriate until you've tried everything possible to address the side effects. I think it's all too often that these issues are not taken as seriously as they should be. And it's not just the discomfort of enduring side effects that's at risk here, but it's the real story is that the majority of people with bipolar over their lifetime take medicines at lower than prescribed doses. They stop taking their medicines, and that's why you have so many breakthrough symptoms. And so long-term tolerability really is the issue. Okay, so typically when you take a drug, this would be true for these bipolar drugs, you take the drug and then relatively soon after, drug enters circulation, and then you get peak blood levels. And typically side effects are more intense when you have peak blood levels, okay? So let's say that you're using one drug, and it could be any of these drugs, but let's just say lithium, for instance. Okay, take lithium, and here we're just using an example of just taking one dose. All right, in real life, you take a dose every day, but anyway, so it reaches peak blood levels within maybe a couple of hours, something like that. And when you get to high levels, this is where you really get more of your side effects. Now, if the side effect happens to be sedation, and that certainly is the case with most of these drugs, including lithium, then you might actually be able to use this. You give the drug 2 hours before bedtime, and the sedation is occurring during sleep. Okay, so you can actually take advantage of that. But some of the side effects are not easy to tolerate. Okay, so a strategy, and this has been used for a while, but I just recently saw an article, and maybe I can get the reference for you, but it now has really shown in this research study that this is a really sensible strategy to use. Okay, is instead of just using one drug, is to early on in the treatment use 2 drugs. Okay, now you don't want to start them at the exact same time, because if you develop a side effect or an allergy, then it's hard to know which drug is causing that particular side effect. But to start a drug like lithium, for instance, and then maybe 5 days later add Depakote. In the olden days, what they do is they'd start with lithium, for instance, and 3 or 4 weeks, or 2 or 3 or 4 weeks later, they say, well, let's switch it, or let's add it on, or something like that. But since most people require multiple medications anyway, maybe you can use 2 drugs. But the other strategy is this: if you use 2 drugs, you may be able to get each one of them where the blood levels are in the therapeutic range, but not so high that it knocks them over with side effects. And actually, this seems counterintuitive. You take 2 drugs and you have less side effects. But if you take 2 drugs and they're at lower doses, they're in the therapeutic range, but neither one of them, get high enough to cause the more severe side effects. Everybody with me on this? Okay, so these 2 drugs actually being tolerated better. And so I think there's an increasing tendency to do this. Okay. Now, this study first in 2002, and it was replicated basically the same results in 2004. And there's something wrong with this study. I'll tell you about it in just a minute. But 140 bipolar 1 patients. Okay. Now, what they did is they had either lithium or Depakote monotherapy. Okay. And you go out 6 months, and the compliance rate was between 50 and 60%. 50% for lithium, 60% for Depakote, because lithium has somewhat more problematic side effects. What they found, though, with this study is the combined use of the medications, compliance rates were close to 100%. Now, that's what's wrong with the study, is that would never happen in real life. But this was an NIMH study where several times a week they were following up with people and they were checking on them, how's it going, you know, and stuff like that. But I mean, the writing's on the wall here that when you use two medicines, but you can come in at lower doses, oftentimes you get better compliance, better tolerability than if you just use one drug and really crank the dose up high. And sometimes 2 plus 2 equals 5. It's not that the drugs are identical, not just additive, but sometimes this drug does this, but this drug does similar things, but also does a little bit more. It addresses other parts of the spectrum of symptoms you see with bipolar disorder.